top reasons people miss work and just about every other activity in life. For kids suffering from migraines, that usually means missing a lot of school, and extracurricular activities are tough to commit to. Joining us with ways to help kids get their life back, please welcome pediatric neurologist from Children's Memorial Hermann at Memorial Hermann, The Woodlands, Dr. Shaun Varghese. Hello there.
Thanks for having me.
Okay, migraines. First of all, when you say migraine, that is so different than a headache. And so how do parents really tell the difference with a child, especially who might not be able to articulate that as well? What's just a bad headache and what could be migraines?
Right, so not just a bad headache. With the headache, they usually get dizziness, vomiting, nausea. They can even get sensitivity to smells. Bright lights and sounds.
With the migraine.
With the migraine,
the migraine has all that other stuff. And if you're having them often, is that another indication that something's kind of off? Right.
If it's happening often, if it's waking you up from sleep, or if there's like some numbness, tingling, or some abnormalities just in the way you feel, that's something to really get checked out.
Yeah, and the hard thing with migraines is that, again, it's one of those things where maybe not one thing works for everybody, but we have to go back to the genesis of them. What causes them? Do we really know, or do we...
Yeah, that's a great question. That's the million-dollar question, really. So there's different hypotheses with channelopathies, vessel diseases, different things like that, but there's no concrete evidence of what exactly causes it.
Yeah, so one of the things you'll do is rule out things. So when a child comes in, the first thing you do is a workup to figure out is there something else that could be causing this, things like what?
Exactly. So the first question I always get is, can you get an MRI on my child? I say, no problem, but let me at least get a history. So I get a history first, then I do a neurological exam. I don't always do an MRI, but if a patient has daily headaches, wakes them up from sleep, or if they have an abnormal exam in my office, I usually get an MRI.
Yeah, because I think a lot of people think, is there a tumor? Is there a brain tumor there?
That's a very common question. Most of the time there isn't.
Yeah.
But the good thing is to come to me, let me figure that out for you.
Okay. Medications are problematic for a lot of people, but especially for kids. So how do we treat it? And is medication part of it? Or is there a level that you go through of things that you perhaps could remove that might be triggering those migraines first before we get to any type of surgery?
Right. So the first thing I do is I give my patients all a headache diary. I'm trying to figure out their triggers, because you find the triggers and then you avoid them. Mm-hmm. The next thing is I do lifestyle modifications. I help them get more sleep. They need to drink 64 ounces of water. I tell them 64 because that means maybe they'll drink 32, but it's more than their zero.
Right.
I do that, and then I have them take a multivitamin. Those are 3 lifestyle modifications I have all my patients start on.
Okay. And then when that doesn't work?
But that doesn't work. They come back to me. I keep the lifestyle modifications going, and then I start a medication.
Which is healthy anyway. All of us should do that.
Exactly. We should all do it. And then I start them on a medication, a daily preventative medication. I don't believe in waiting for headaches to start and then treating it, because it's a vicious cycle.
And this is different than like a pain medication would be, right?
Exactly. It's totally different. A lot of patients take pain medications frequently, and that actually causes rebound headaches, so it's actually making their headache worse.
Yeah. Okay. So the medications they take, it kind of just stops it from happening.
Correct.
Okay. And so that medicine stops it from happening, and then can kids outgrow the migraines at some point?
So typically, boys usually start having their headaches around age 8, and girls around age 12. And then if they continue to have them through their adolescent period, then once they get into their 30s, 60% of them have migraines.
Okay. You have patients who literally have gotten their life back. We mentioned that with adults, with jobs and stuff, who couldn't keep a job. There are a lot of students who end up failing school because they can't show up.
That's right. I actually had a patient that came to me, a 15-year-old, that came in for school problems. The mom came to me and said, can you please help my son? Asked the child, what was going on. He said, actually, I am having headaches. He says with the headaches, he has a lot of confusion. So I started him on the lifestyle modifications that I talked about and a preventative medication. He came back to me 6 weeks later, and he had been headache-free. His grades went up to A's and B's. His teachers report to his mom that he's actually smiling. He used to not smile. So he actually started smiling and talking and making new friends. So headaches were totally kind of ruining his teenage years.
Yeah. He's a whole new child now. Okay, so when you mention that medication that you give, is that something you would take every day, or is when you feel a headache coming on that you can stop it?
Yeah, that's the key. You take it every day. I usually have all my patients keep it by their sink before they go to bed. They take 1 pill every day, and that prevents the headaches from even starting, because you don't headache after it starts.
Right, because oftentimes you can't chase it. It's got to run its course there. All right, Children's Memorial Hermann in the Woodlands. Tell us about the hospital itself. And what's kind of neat is that we're seeing hospitals kind of move out to the community, like the doctors coming into the community today.
Yeah, Children's Memorial Hermann at the Woodlands has been very supportive. They helped me open THINK Neurology for Kids. We see kids in the NICU, in the pediatric floor. All the MRIs, all the labs are done on campus, so it's a very comprehensive setting. And we also have pediatric gastroenterologists and cardiologists, so all these patients can get all their care in one location.
Yeah, and it's a happy hospital.
It's a happy hospital.
You can take a few adults there because I like the way it looks in a happy hospital. So very, very cool. I know this is a big relief to so many parents, and I love the distinction between pain medication, which is one thing, but this is a different type of medication where you're actually stopping that headache from happening to begin with. All right, if you suspect your child may be suffering from migraines and would like to consult with Dr. Varghese at Children's Memorial Hermann in the Woodlands, you can call 713-222-CARE. That works out to be 713-897 is another number you can call, 2300, 713-897-2300, and log on to memorialhermann.org as well for more information. Well, the sniffling, sneezing, wheezing, time to